David Johnston.
Deputy Speaker, all the GP surgeries in my constituency have worked incredibly hard through this period, and I got to see some of that up close, volunteering in the weeks that I could with the vaccination effort, and it has been a complete whirlwind for them this entire period, and they went straight back in then to this huge demand on appointments, and I commend them for what they did during COVID and what they're doing now. But obviously part of the job of an MP is to not just champion, but to challenge. And like every other member of this House, I have had complaints about the difficulty in getting GP appointments, which I need to raise with surgeries. And sometimes those complaints are about getting an appointment at all. Sometimes those complaints are about getting a face-to-face appointment. Sometimes those complaints are about getting through on the phone. Sometimes those complaints, more in dentistry than with GPs, it has to be said, are about the ability to register. And we know that the COVID pandemic is a huge part of this problem, because we asked the public to stay at home and protect the NHS. And they did it almost to a fault, because I remember ministers at the dispatch box as the pandemic went on pleading with people to come forward if they thought they had things, but people understandably didn't want to burden their GP, didn't want to burden hospitals, and they're now rightly coming forward, or they've got hospital treatments delayed again because of the backlog there, and so they're going to their doctor instead. Sometimes my constituents are unhappy about not getting face-to-face appointments. They dislike e-consult, they dislike telephone appointments, and I've used e-consult successfully myself. I think it does have a place. But with both those things, as one of my GP surgeries, one of the GPs at one of my surgeries said to me, the risk is you don't see the thing the patient hasn't come in about. So a patient comes in about their leg, and while they're there you say, can I just have a look at that thing on your neck? And so, again, I think e-consult, telephone consultations do have a place. Yes, I will.
I completely agree with the point that he's just made about not identifying the issues people have not come in for. And I wonder if you agree with me, one of the other things that doctors can notice on a face-to-face appointment is sometimes victims of domestic abuse and violence.
Yes, I completely agree. I think the Honourable Lady's made a very, very important point. Sometimes what people are presenting with is not the biggest issue in their lives, and a skilled practitioner can uncover that. Partly, as has been touched on, this is about telephone systems, bizarrely, and I'll come on to that a bit in a minute, but it is undoubtedly about a shortage of GPs too. And I think the government is gripping this. We've got 1,500 more GPs now than we had in March 2019. We've just seen 4,000 trainees take up training places in this year compared to 2014. We've had a health and care levy, which, as has been touched on, the Labour Party opposed, but is providing £12 billion a year to the health and care systems. There's more money for improving telephone systems. There's more money for improving face-to-face appointments. And looking at the data this morning, we have 2 million more face-to-face. We had 2 million more face-to-face appointments in April this year than we had in April last year. But of course, we're still below the pre-pandemic levels. And with dentistry, because the complaints I get about dentistry are much more, I can't register anywhere, and there's a particular issue with the promise we make to pregnant women actually about being able to see a dentist, which even they're not being able to get registered. And I met the minister on the front bench about this very recently, and there it feels the issue is less than with GPs and the shortage. It's partly about this contract, which there seems to be cross-party agreement on, that this 2006 Labour contract does need to be changed. But I'm also pleased that the government is going to allow more internationally qualified dentists to be able to support the dental system here. But there are two things, just in closing, that I think we do have to get better at. One of them was touched on by my honourable friend, the member for North East Bedfordshire, because we have also, in my constituency, seen huge housing growth. We've got two housing developments just in Didcot alone, which are adding 18,000 people. And the promised GP surgeries for these increased populations never arrive. And we've got to get much better, as he said, at putting this infrastructure in first and being better at planning for these increased populations. But the second thing I'll finish on, some members of this House may know that I worked in social mobility before I became an MP, running charities for disadvantaged young people. And unfortunately, the medical profession is the most socially exclusive profession in the country. Only 6% of doctors are from a working class background. You are 24 times more likely to become a doctor if you have a parent who's a doctor. That is worse than politics, worse than the media, worse than law, worse than any other profession you can think of. And there are lots of reasons for that, about the allocation of work experience, how the recruitment process works. 80% of applications to medical school come in from 20% of schools, whole range of things. But for the young people I worked with who were eligible for free school meals, very high proportion from ethnic minorities, it was the most popular profession that they wanted to go into. So on the one hand, we have a shortage of GPs, and then we have this incredible talent pool that finds it can't get into the profession. And I do think one of the things that the government might think about, as well as this, how we get the infrastructure in first, is how we better access what is a hugely popular profession for certain groups of young people that I used to work with. But at the moment, they simply don't get into it in the numbers they should, and they might help with this GP shortage.
Yeah.